The 1992 Constitution of Ghana under Chapter 5, under Article 30 and 34, Clause 2, states that, therefore, guarantee the right of persons in Ghana to good health and care. Article 34, Clause 2 reinforces this right by mandating the President to report to Parliament on an annual basis steps taken to realize the right to good health care. However, the enjoyment of the right to good health care appears to be waning, and this is as a result of the increasing reports of medical negligence cases in Ghana by both public and private health facilities. In this report by Ashanti Regional Correspondent Isaac Bediako, a story is told of how a 41-year-old woman lost her left eye in a facility she attended for eye care in Dormaa Ahenekro in the Bono region.
Medical negligence cases pose a serious threat to quality healthcare delivery as logistics and monies available to improve health facilities are lost to payment of damages. More money is lost in cases where issues of negligence are lost through litigation before being sent to court, where delays and increased costs are prevalent. Currently, a 41-year-old from Dormaa Ahenekro in the Bono region has sued a private health facility at the Kumasi Human Rights Court for destroying her left eye, which did not require surgery, according to eye specialists. In 2015, Antiama reported to a health facility in Dormaa with a complaint of pimples developing on her eyelid, causing it to swell and subjecting her to a severe headache. According to her, she woke up the following day with a badly swollen face after taking a prescription the physician gave her. But upon seeing the patient's swollen face, the physician then proceeded to conduct surgery on her eyelid and subsequently removed the eye completely. The physician, not a qualified eye specialist at the time of conducting the surgery, decided to fill the eyelid and eyebrow flesh and attempted a graft with flesh taken from the back of the patient's neck. After an unsuccessful surgery, Antiama was referred to the Komfo-Anokye Teaching Hospital in Kumasi for further treatment. Narrating her ordeal, Antiama tells GH1 News she contemplated suicide.
Ashase no na min ko bebia na minim hwe no mra yedi kan refer me hospital kese pa se min ko no Komfo-Anokye yes enka min ko no madru efi say sa hospital no miniska nti na e wo madwene mi say me no madru no ma me ko top poison crab isi ho na me wo last born girl bi wo kitwa ono no je adru no free me nsem na omo. The
mother of all feels shortchanged and disrespected by the doctor, who after the failed procedure only gave her a written note to solicit funds for another surgery.
And so when some in a basano, we can refer me hospital by Koseminko, not very refer me in Komfo-Anokye. Na ba ko na me ko no doctor no hwe me no seda on hwe me bi on e de on fa den san kame ma me sign ba do man ti me ba no say me fa doctor na number man ti me de doctor na number na man no free doctor no me manim de na ne bo afu pa sa doctor no ba me ba ya me call hospital ho no doctor no say ma ko bo ne charge nti on hwe me ampa o man hwe me bi.
Kwame Mensah, not his real name, also lost his wife and newborn baby at a health facility because the pregnant woman was forced to deliver her naturally instead of a surgical procedure they opted for. According to investigations, the process lasted for 1.5 hours, resulting in a cervical tear and caused the woman to bleed heavily. The facility later referred her to a different facility when her condition deteriorated and noticed the facility's theater could not support the surgery. Unfortunately, both mother and child died later upon arrival after being transferred to another facility.
It was quite heavy for me. I just couldn't process the whole thing because this is someone who has visited the hospital right from the beginning, when she took seed and the antenatal checkups and everything. This hospital knew these records and history of the woman, and so I was expecting them to do better. And so we we had to get a place for her. I mean, put her in a place and then rush back to check on the baby. On my arrival at the first hospital, I was told that when we left, some few minutes later, the baby also passed because the baby did not have enough strength and enough oxygen. And so because the mother forced the baby out, they gave me a term, fetal distress. And so the baby could not live. How can a husband take a pregnant wife almost about to deliver to the hospital and then loses the woman or the wife and loses the baby in addition? I just couldn't take it. I was just helpless.
However, at this year's third annual Nurses and Midwifery Leaders and Managers Conference and Excellence 2022 Awards held in Kumasi, the issue of medical negligence featured prominently in the opening address of Deputy Health Minister Tina Mensah. The minister disclosed the Health Ministry is overwhelmed at the number of court suits before the ministry over medical negligence and lack of respect for human dignity, among others.
The ministry is being sued here and there by some of the treatment that they give to patients at times. So it's all well and good for us to tell them that since they have taken up the job to do, we all decided to choose the job that we want to do. So if they have chosen the profession, then they should live up to the profession. They should treat people with dignity. Coming to such conferences, letting them know. And at times we do sanction when it is worse on a part of a nurse or a midwife. The ministry has a way of sanctioning them to do the right thing.
This growing unfortunate developments has prematurely terminated several lives of some family breadwinners, while several others have become a burden to their family, causing poverty, among others. This is because some family members in their productive working age have to drop out from work or school to take care of their family victims in this situation. Executive Secretary for Kumasi-based NGO Advocacy for Medical Malpractices, Kwame Bobe Apia, tells GH1 News the NGO remains steadfast in protecting the rights of victims of medical negligence.
We have had people from all walks of life, people from varying backgrounds, including health practitioners, because they are human beings and are potential patients. The fact that as a doctor, as a nurse, as a midwife, you work in these institutions and you feel that we are out there to antagonize you, then, it's a non-starter. Reason being that, like you rightly asked, they can also fall ill and be given similar treatments that are not well and up to scratch, and they might be victimized at a point in time. So it's true. We have had cases involving health practitioners who have also fallen victim to the negligence of their colleagues.